Hello and welcome to vlog number 110. This week I'm going to give a brief update on my quest to be prescribed Exenatide by my local healthcare trust. I contacted my Member of Parliament, Norman Lamb, about this situation. He agreed that given the support of 3 healthcare professionals, it was reasonable to expect the local healthcare trust to allow me to be prescribed this drug. And he wrote letters on my behalf to the North Norfolk Clinical Commissioning Group, or CCG, and the Chief Executive of the local healthcare trust. In vlog number 108, I discussed the response received from the CCG, in which they labelled Exenatide, a drug licensed for type 2 diabetes, as being an experimental drug and restated their refusal to fund it for me. I have, since then, asked Norman to write to my London neurologist, who supports my request for this drug, to ask her if she would be prepared to submit an individual funding request on my behalf, so hopefully she will agree to do this. In the meantime, I have received a copy of the response from the Chief Executive of the Healthcare Trust. He correctly states that the decision to prescribe this drug lies with the CCG, but, for some reason, feels it necessary to provide background information to place my request in context. Much of this background information is inaccurate and appears to be designed to make my MP think that I've got my facts wrong. So I couldn't resist the temptation to respond in detail and set the record straight. Firstly, the Chief Executive attempted to trivialise the findings of the recent clinical trial of Exenatide by stating that patients that received Exenatide were 4 points better on a scale of 132 points, and hence had a clinically questionable benefit of just 3%. He neglected to mention that the scale employed by the study was the Unified Parkinson's Disease Rating Scale, or UPDRS, that the average Parkinson's patient will be expected to increase their score by 2 to 3 points on the UPDRS over the course of the study, and that those who received Exenatide decreased their scores on average by 1 point, whilst those receiving the placebo deteriorated as expected. I think that this is a very significant outcome when put into its correct context. Next, the Chief Executive justifies not prescribing Exenatide by stating that my Norwich neurologist does not have any experience of prescribing it to Parkinson's patients. Well, that's easily remedied, isn't it? Then the Chief Executive says that caution is exercised when prescribing Exenatide even for those patients with diabetes due to a long list of significant side effects. Side effects that are no more frightening or serious than those of Malapar, which is a levodopa medication commonly prescribed for PD. Finally, he suggests that since there weren't any patients with deep brain stimulation, or DBS, on the trial, that there was no evidence that it would be beneficial to someone with DBS, and the fact that I've had DBS indicates that I have severe PD. This seems extremely disingenuous to me. He should know that the reason for excluding patients with DBS from the clinical trial was to prevent the skewing of data by any improvement that may have been due to the presence of the DBS hardware rather than the Exenatide. Further, he should have been aware that DBS is no longer considered to be a treatment of last resort. It is, these days, known to be of such benefit to quality of life that it is considered at a much earlier stage, and so may no longer be indicative of disease severity. So, I have emailed my response to Norman Lamb and eagerly await his reply. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.